Did you know that there is an unspoken connection between ADHD and porn addiction? Well, I'm Dr. Trish Leigh, and in today's video, I want to explain that connection to you. So in this video, the first thing that we're going to do is talk about ADHD. What is it? What causes it? How do you know if you have it? Then number two, let's break down porn addiction. What is it? What does it look like? How do you know if you are struggling with it? And then lastly, number three, what is the connection between the two of them and what can you do about it? All right, let's start with ADHD. ADHD is a neurodevelopmental disorder. So what that means is that it's brain development. So if you have been diagnosed with adult onset ADHD, that's not a thing. ADHD is neurodevelopmental. You were born with it and it happened within your development. Now, not to say you can't struggle with ADHD symptoms that began in adulthood, because we know that especially if you use the screen and consume pornography with excessive amounts, that can create the brain pattern that gives you ADHD symptoms. But ADHD in and of itself is a neurodevelopmental disorder. So what causes it is a brain pattern that needs excessive stimulation because it is running too slow. It is a brain pattern with excessive use of the electrical energy speed theta. Theta is the slow speed that helps your brain fall asleep at night. But if you're using too much theta within the day, it makes it very difficult to attend, to focus. It might create fidgeting. It might create excessive movement. It may make it difficult for you to be motivated to task and stay there. That's very similar to what happens if you watch too much porn. We'll get there in a minute. But ADHD, again, is the brain pattern that you were born with that makes it so that your brain is using too much slow speed. We know from the science that ADHD and anxiety are highly correlated. And the reason that happens is because if you're born with a brain that's running too slow, your brain will kick it into high gear using excessive high beta, extra fast brain speed to offset that slowing. So what happens is now your brain's moving extra slow and the compensatory pattern of extra fast. So I've always used this analogy of your brain as a car that's driving down the road. To get to where you want to go, your brain needs to go 45 miles per hour, right? You get there on time, but you don't crash. But what your brain's doing if you struggle with ADHD is you're going 25 miles per hour. You're going much slower than you need to get where you want to go in an optimal fashion. So your brain pushes that gas pedal to the metal. So inherently, your brain's going 25, but with this compensatory strategy, now you're going 75. And a lot of times that can create crashes. So the ADHD pattern is one of too much slowing and most times also too much fast speed. How can you know this for sure? Get a QEEG brain map. So when you have an assessment that looks at not only your behaviors, but your actual brain performance pattern, the one that's in there that a professional can visualize, see it, and share the findings with you, then you know for sure if your brain is operating in the ADHD mode. There is a true brain pattern, and looking at theta to beta ratio, they call it the TBR, can show you if your brain is running in the ADHD manner. That is exactly what me and my team do. We're able to show you how your brain is performing and then show you how to optimize it. Now, a disclaimer on neurodiversity here. I'm not saying that anybody should change their brain pattern if they're happy with it. What I'm saying is that if you're struggling with ADHD symptoms and they're holding you back, like they hold so many people back, you can in fact optimize your brain pattern and take your brain out of these extremes and teach your brain to function in the optimal mode of calm focus. Your symptoms go away and your life improves. All right, so that's ADHD. Now let's move on to porn addiction. Porn use usually starts as use First, in adolescence, childhood, or young adulthood. So when you were young, you found porn and it gave your brain the best feeling that it probably ever had. So what happened in those young years and days was that your brain got a high level of stimulation. This is exactly what the ADHD brain is looking for, to stimulate it and calm it down. So we know from the science, if you struggle with the ADHD brain pattern, you're more at risk for being extra aroused by pornography. So it begins as use when you're young and likely shifts to misuse at some point where you start using it more, you start getting dependent on it, which shifts into abuse. So now maybe you've missed work because you lost track of time because you're watching porn, or maybe it's shifted into a compulsion where you can feel that pull back to the screen. Your partner leaves for work, you feel like you want to watch it instead of getting ready to go to work yourself. When you're in the middle of your workday, you feel that pull. That pull is a compulsion, and we know that the International Classification of Diseases has identified compulsive sexual behavior disorder as a true health concern, and pornography use is the number one way that that manifests. That pull is that compulsion, and that compulsion develops even further into addiction. The difference is, if you fall into addiction, now you need porn to feel okay, and your life feels miserable or it feels incomplete when you're out in the world because your brain has changed its mechanisms on the inside to need porn to feel good. You need it to be able to get through your life. That is not a place I want you to be, my friend. I want you to break free from that if you're struggling with it. That's what porn addiction entails. The addiction piece is now you need it. And it changes the brain mechanism so there's a dopamine deficit when you're in the world. There's not enough pleasure and happiness. But when you think about porn in the screen, you get a drip of dopamine, which pulls you back into the screen so that you get that dopamine deluge, that flood that drowns out the real world and makes you feel good for a little while. But what happens if you get roped into this loop of porn addiction is that you actually increase alpha, that medium speed of calm. You increase it too much. I like to refer to alpha as couch mode. So your brain, when it's functioning optimally, should be able to relax and chill out on the couch and should be able to focus and do your best work. Two medium speeds, alpha and low beta. Alpha's couch mode. And if you consume a lot of pornography, you are using much too much alpha because your brain's been flooded with dopamine. Now you're stuck in couch mode. You're not motivated to get your best work done. All you can think about is feeling good and laying around with that good feeling. That's how you know if you're thinking about getting back into the screen. That's how you know your brain is dependent on dopamine to feel good. Now, how are the wires crossed in terms of ADHD and porn addiction? Well, I've already shared that we know that the ADHD brain wants stimulation and calming more than an optimal brain. And we know from research that the personality types, perhaps the brain pattern that gives you the feelings of impulsivity and not being able to calm down, we know that that is a driving force back into the screen. So there are traits that overlap. And again, this loop makes it so that if you have the ADHD brain pattern, using porn worsens it, not makes it better. So you're reinforcing those neural pathways of ADHD instead of doing things in your life that would help those pathways to die down so that you could focus and be motivated. So if you consume porn, and if you are struggling with ADHD symptoms like lack of focus, lack of motivation, difficulty starting tasks and finishing them, then there's something going on with your brain pattern. I would love for you to get it assessed. That's something that I do. And if you don't want to work with me, have someone assess your brain pattern using a fundamental 4-point assessment, which is exactly what we do. Neuro, we look at brain performance pattern. Bio, we look at other biofeedback mechanisms, and we look at how your heart rate, your breathing, body accelerometer, how still you're able to be or how much fidgeting there might be involved. We look at many other biological mechanisms. And it's a social approach too. We look at your environment and the way that you're using your brain, how it impacts your brain performance pattern, like porn consumption. And we look at how those wires are crossed and tangled so that we can untangle them, improve your brain performance pattern, and help you rock out your best life. So if you're interested, please go over to drtrishleigh.com. You'll see under the neurofeedback coaching tab that there's descriptions of how we can help you to be able to figure out how we can optimize your brain and help you rock out your best life. All right, until next time, control your brain or it'll control you.